Good evening from Singapore, from Southeast Asia. It's very late here, but it's an honor and privilege to be part of this commission and to have worked with amazing colleagues from around the world. One Health Knowledge is the last section of our report before the recommendations, which I think is a fitting culmination because this report in itself is knowledge, a synthesis of the current state of One Health knowledge and a roadmap for the future knowledge that we will have to co-create and share to improve the world. This report also reminds us that we must be perpetual learners of One Health, never stopping to learn, constantly open to diverse ideas and perspectives, committed to translating knowledge into real impact on people and the planet and all its other inhabitants. I think One Health is not just about knowledge about life, but it is living knowledge. And so if you will read this section of the report, you will notice that we use the word knowledge because it's not only about education and the role of the university. Our report navigates various what I call dualities of One Health knowledge. One Health is global, both global and local in source, in reach, in relevance, and in impact. Knowledge from academia and from the university, but also knowledge possessed by local communities and indigenous knowledge systems, which has already been alluded to repeatedly over the past 2 hours. Knowledge also between the young generations and those who are young at heart. And so, if you are a young One Health learner in this Zoom, please give a thumbs up because we want to see the future leaders of One Health. And also One Health knowledge is not only about the technical, but also leadership, community building, outreach, driving transformational change. So those are some of the highlights of the One Health knowledge section in the report. I'm sure you all know the adage, knowledge is power. Knowledge is vital. And that's why it's not an accident that 3 out of the 10 recommendations, which were presented a while ago, are about One Health knowledge. One is mainstreaming One Health throughout the higher education sector, not only in the classroom, but also through experiential learning, to cultivate enabling conditions for One Health research and knowledge production, and to achieve a One Health literate global citizenry. Again, citizens, not just professionals, because One Health literacy, according to our commission, must happen throughout the life course, from teaching One Health to children all the way to making media and journalism as allies in One Health communication to the broader public. So now let's add equity to these recommendations, because that's the main question. Equity may be a central tenet of One Health, as mentioned in a report. But equity, unfortunately, but unsurprisingly, does not happen automatically. We must be intentional. We must be proactive. We must tackle not the cosmetic, but the systemic. It is true for making One Health knowledge systems equitable, but it also applies to other avenues for One Health operationalization. So how can we make One Health knowledge more equitable? We need to establish more One Health centers, programs, networks. Our report cites the likes of CEOHUN and AfroHUN. We need more of them. We need to sustain these networks. A landscape paper that I co-wrote a few years ago revealed limited One Health programs, both in number, but also they're concentrated still in the global north. But there are promising examples from places like Rwanda, from here in Southeast Asia. More needs to be established, not only to strengthen One Health capacity in low and middle income countries, but also for high income countries to learn from LMICs, because One Health learning is bidirectional, even multidirectional. And to colleagues and friends from the global south who are here in Zoom, or those who are from outside of Europe and North America, let's do One Health in a way that integrates global and local science, knowledge, culture, innovation. Yes, we do have shared principles, many of which are embedded in this report, but there is also space for many One Health solutions and innovations to bloom in different contexts and geographies. We must also call for sustainable and equitable funding for One Health research, especially with these funding cuts, the funding landscape that we have. But we also need to find or to remind funders to go beyond talking and giving promises about funding One Health or climate and health or transdisciplinary and cross-sectoral work. We must demand our national governments to invest in One Health knowledge systems, institutes, learning communities. We must leverage digital technology to ensure the rapid dissemination of and universal access to One Health knowledge and solutions. But we must also make sure that technology, whether it's the internet or AI, does not exacerbate existing digital, social, and health divides. We, One Health community, must synergize with other related, in fact, connected communities like Planetary Health, to which I also belong, Eco Health, Geo Health, because we all have a shared goal of healthy people, healthy planet, healthy creatures great and small, air, land, and water. And we must lead in the defense of knowledge and science in this time of dis and misinformation and distrust towards science and institutions. If science is under threat, One Health is in jeopardy, and our collective health is not safe. And finally, to the young One Health learners in the class Zoom, I always remind my students that by the time you graduate from school, you must have at least 5 new friends who come from other disciplines. That's One Health. You must also read papers and books from other cultures, places, knowledge systems, and not only from the usual suspects. Learn One Health not only from the classroom, the conference, reports, and webinars like this, but from the communities in the real world, from people in the front lines. These are some practical tips that hopefully will help you make or become an effective and equitable One Health professional and leader. In closing, my fervent hope is that we will all work together with solidarity and humility to unlock the power of One Health knowledge of all forms, to drive transformative, systemic change for the achievement of equitable and sustainable health for all constituents of the socio-ecological system. I hope that the knowledge in the Lancet One Health Commission's report will be our steady and constant guide towards health for all. Thank you very much.